Hey mamas, welcome back to In the Beginning Postpartum Home Care. This is going to be my first educational video. I was asked to post this video from a friend of mine who is having a baby, and she was just kind of curious, what do you bring to the hospital? So that is an important question because I know when I had my children, I went to the hospital, I had no idea what to bring, and I'm pretty sure I didn't bring much. Good news is the hospital does have a lot, um, like gowns and things like that. But if you want to be prepared, this video is for you. So first, let's start with mom. So what does mom want to pack in her bag? So first, let's start with the birth plan. Every mom's birth plan is going to look different. It's going to have several different things on it, like, do you want an epidural or not? Different positioning, things like that. If your baby's going to get a circumcision, or if you want the erythromycin ointment, the eye ointment for the baby, or the vitamin K or Hep B shots. If your baby gets a circumcision, you have to get the vitamin K shot. It's different things like that that you're going to put on your birth plan. Also, like delayed cord clamping, who's going to cut the cord, who you want in the birthing room with you, all those different things. And it's going to look different for every mom. So you can get templates offline, you can create your own, and the hospital will do their best trying to follow this birth plan. However, if there's complications and they can't follow it exactly like you wanted, then they're gonna have to go with the safety of mom and baby. But they do try to follow the best they can. So your birth plan, so that's something you want to look at, and you might want to discuss with your partner and have ready to go with you. Also, you might want to think about bringing some comfortable clothes, some loose outfits, some but if you're gonna breastfeed, some like button up shirts, or shirts that you can get to your breast so that you can easily breastfeed. You might want to do some socks. I would say bring like 2 or 3 outfits, because you're probably going to be in the hospital about 2 days. You're going to want to bring home or come home outfit. And then just in case you get blood on an outfit, you might want an extra outfit. So I would say 2 or 3 outfits and a outfit to come home in. You want to bring that. Also, you want to think about bringing some bras and some panties. The good thing about the hospital is that they do have some pretty good panties that a lot of the moms seem to like at the hospital. You can bring your own postpartum panties, but the ones in the hospital, moms really do seem to like, and they are washable if you want to bring them home. So bras, if you're breastfeeding, you do want to make sure you get breastfeeding bras. You probably want to get some comfortable bras. If you're not going to breastfeed, you want to think about when your milk does come in. That's probably going to be after you leave the hospital, but then you're going to want to get some tighter support bras. Postpartum care. A lot of women worry about this. Like, what do I need to bring to the hospital for postpartum care? And you can bring a postpartum care kit. They do have them at Walmart. You literally can get a kit that has everything in it, like the peri bottle and tux pads and all those different things. But at the hospital, they will provide you a peri bottle, pads, ice packs, the panties. They'll get you tux pads. They'll get you the spray, the lidocaine spray, the Dermaplast. They'll get you the Dermaplast spray. You can also ask them for a sitz bath. I know the sitz bath is usually for hemorrhoids, but I loved the sitz bath when I had my baby. My daughter loved her sitz bath when she had her baby. So the sitz bath, you can ask for that as well. So they have all those things at the hospital. So if you want to get a postpartum kit for at home, you can do that. And the postpartum kits in the store, they actually have an angle bottle that looks like this. So this is an angled bottle. The ones in the hospital, they're more straight, so they might be a little harder to spray with. And so this angle one is kind of nice, but they do have the straight ones in the hospital, so you don't necessarily have to bring a peri bottle to the hospital. So here's the one from the Walmart, the spray foam, and then here's from the hospital. And then again from Walmart, hospital. And this, by the way, is a sitz bath, just in case you don't know. It comes with a bag. It's hard to see, and it's just, I'm sorry, with my filter, it's kind of hard to see it. There we go. And it's got this tubing. You just fill this bag from the top. I might do a video on how to actually do a sitz bath, but that's a sitz bath, and you can use Epsom salt at home, and the tubing just kind of goes down into the little tub part. You put it on your toilet, and then as the water flows down by gravity, it kind of like bubbles up that water, and it's really soothing on that area down there. So again, don't necessarily need to bring postpartum stuff to the hospital. You can if you want. It is there though. Definitely bring your phone, your charger. You're going to want the entertainment there. You're going to want your phone for pictures. Do not forget your charger. It will die. Some people, you know, they're in labor for days. You know, you're going to spend at least 2 days in the hospital. But if you spend 2 days in labor and delivery, then you spend 2 days in postpartum care. You know, that's a long hospital stay. You also want to bring hair ties, put your hair up, and a brush to brush your hair. One important thing is shoes. I would definitely recommend shoes. They do have people who clean in the hospital, but, you know, it is a hospital floor. You know, the showers, it is a hospital shower floor. So you can get cheap Dollar Tree flip-flops and just use them as your bath shoes and just wear some slides or something to walk around in the hospital room, or some slippers, something like that. They do have towels and washcloths and all that at the hospital, but they are kind of small and they are kind of rough. So you might want to bring your own towel, shampoo, conditioner, body wash. Again, hospital does have it, but they're small containers and it's not your own. So you're probably going to want to bring your own toothbrush, toothpaste. Again, hospital has it, but you might want to bring your own. It's kind of small. Face wash, lotion, deodorant, all that stuff. Face wash, I don't think the hospital has. Lotion and deodorant, I do believe they do. But again, small containers. I mean, they're not going to give you a bunch. You're not meant to stay a long period of time. So you're going to want to bring your stuff from home, especially since you have a certain scent you like. And if you've got sensitive skin, you want to bring what you have from home. I know one thing I didn't think about when I was having kids was chapstick. My daughter, she just had a baby and she had that chapstick and it was a lifesaver for her. I know she kept asking me for her chapstick. You get very dry. I mean, even if you're eating the ice and drinking that water, your lips get very dry. So you want to make sure you have the chapstick. So for dad or whoever else is staying with you, kind of along the same things. I mean, they're going to need clothes and shampoo and maybe not well, it depends on who stays with you. They might need conditioner, toothbrush, toothpaste, you know, all those normal things. But they may need a razor, their wallet. Don't let them forget their wallet. Somebody needs money. So somebody needs to bring money because they're probably going to run out and get you food, you know, especially after you have the baby. Same phone, charger, all those things. Basically all the things that you're bringing, they're probably going to have to bring too. Snacks. Now the hospital does have some snacks. I don't know that they necessarily like tell you they have snacks, but they do have some snacks. Some nurses might offer a snack. But bring some snacks. Some people might not want to eat in front of mom if she can't eat because she's in labor. But you can bring snacks because it could be a long labor and you could get hungry. One thing I would definitely suggest to bring are pillows and blankets. Extra pillows for mom because the beds can get uncomfortable and the bar can get right there, on the booty. Also for dad, because it depends on, or whoever's staying, it depends on what kind of sleeping arrangements there are. Where I used to work, there was just a recliner. Not very comfortable. Also, there were times where the unit was full, so we didn't have extra pillows and blankets. We did our best. We looked around. We tried to do everything we could to get pillows and blankets, but sometimes there just weren't any. So bring extra pillows and blankets because you don't want to be left in a recliner, without a pillow and blanket. So I would definitely make sure that there are some extra ones of those. Another thing you can bring, it depends on the hospital if they'll let you put it down or not, is an air mattress, just in case they don't really have a sleeping area. There may be room, there may not be room. Again, it depends on who you get or not, if they'll let you put that air mattress down, or even like a sleeping mat might even work as well. All right, so let's talk about baby. What should we bring for baby? Again, the hospital probably has a lot for baby. They have hats and they have blankets and onesies and socks and mittens. And we had crocheted like blankets and stuff we'd send home. And I'm pretty sure they had like donated clothes and things. But it depends on your hospital what you have, so you want to be prepared. So you're going to be in the hospital at least 2 days, depending on how long your labor is, maybe 3-4 days. But postpartum is usually 2 days. So bring at least 2 to 3 onesies. You want to bring a couple hats, so like 2 hats. Now, the issue I've been seeing with the hats is usually the hats that come with the outfits that are bought in the store are usually too big for the baby's head, unless the baby ends up being a bigger baby. So usually the hospital hats do tend to fit better. So either way, you'll have a hat because the hospital always does have a hat because it's very important temperature control for the baby, which will be another video. But so make sure you have a hat. You can bring gloves or mittens, whatever you want to call them. If you forget them, just ask the hospital. They should have some. Of course, you want a going home outfit. One thing I would keep in mind about these outfits, something I experienced with my babies was I bought newborn outfits for my babies, and they actually ended up being in preemie outfits. And then my last baby, she ended up being, so I brought preemie and she ended up being in 0 to 3 months. So my advice would be bring preemie, newborn, and 0 to 3 months, because honestly, even if they tell you your baby's going to be a certain weight, you never know. So just be prepared. So that's what I would bring. Bring a good swaddle. The hospital has blankets, and they'll show you how to swaddle your baby. But I really like the really stretchy swaddles. You can buy them off Amazon. It's not the regular muslin blankets, I think it's called. It's the stretchy ones. I really like those ones. They can stretch and you can just kind of maneuver them how you want and really get that baby wrapped up good. And I can do a video as well on swaddling a baby. They really like to be swaddled, so I would definitely bring some of those. If you plan on giving your baby a pacifier, you can bring a pacifier. Hospitals do have pacifiers. If you plan on breastfeeding, the hospital more than likely, especially if they're baby friendly, will not want to give you a pacifier because it causes nipple confusion. So that's another thing to think about. You can bring some burp cloths for that spit up. So yeah, so use those burp cloths for the spit up. Also socks. You want to keep the baby warm. It's very important to keep a baby warm. Another thing my daughter had taught me when she had her baby 2 months ago that I did not know is Vaseline. You can put Vaseline on the baby's bottom because they're going to poop and it's going to be meconium and it's very sticky and it's very hard to get off. I've wiped babies' butts and it it is very hard to get off. So with the Vaseline, it just wipes right off and it's really nice. Again, they have towels in the hospital for the baby, but they're not the softest. So if you want to bring a soft towel for the baby for the bath time, you can. Now that's up to you whether you want to give the baby a bath in the hospital or not. A delayed bath is good for the baby. That will be another video as to why that's good. But that's also something else that you would have to decide if you want to delay the bath or not. So some other things that I found very helpful with patients coming in, or even in my daughter's recent delivery that she had, was a massager. I would definitely recommend bringing a massager. She had this on her middle lower back when she was having contractions, and it really helped ease the pain. She did not get an epidural. She was very determined not to get an epidural, so we tried to do everything we could to help her not get an epidural. And I think bringing the massager was a lifesaver, because once that contraction kicked in and I was able to push the massager on her lower back like that, and the massager just kind of goes like this, it really helped ease that pain for her. Another thing would be a fan. They have these fans that like loop around and you can connect them to the bedside, and you can aim it wherever you want. Charge it up before you come, bring it. Mamas get really hot, so that's also another lifesaver. Some moms like music. Some moms like soothing scents. You can bring all these things. Ask the hospital about the smells. Some may allow you, some may not. One thing that I was very glad we did when my daughter had her baby, and I'm not sure that other people did this. I didn't really hear if anybody dedicated somebody to take pictures, but I'm glad we did. Dedicate somebody to take pictures so it's not chaos, and you know who's going to get the pictures, and you got those pictures, because these are memories that you are going to want. All right, so just a few more items that I would suggest. These contractions, especially if you don't get an epidural, they become intense. So like I said, that massager, it really helps. A stress ball, something to squeeze. So like I said, a stress ball. Or my daughter, she had a comb. She found it from a video. I've never seen, when I was doing postpartum care and I did some labor and delivery, I never seen anybody squeeze a comb, but she did. She squeezed the bristles of a wide tooth comb, and it really seemed to help her as well. So that as well, those are things, it just kind of takes your your mind off the contraction, and you're squeezing those bristles in your hand. Boppy pillow, definitely bring that. I mean, you're gonna bring pillows, and the hospital will hopefully have extra pillows depending on how full they are, but the boppy pillow, I feel like the boppy pillow is a lifesaver. I love the boppy pillow. Another thing that people might not think about, that as a nurse I can tell you is really, 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 really appreciated, is gifts for the medical staff. And we do get gifts a lot, so people do think about it. Usually they'll buy food and stuff, but it's really nice when there are gift baskets. We made really nice gift baskets for the nurses. We put different things in there, like gum and pens and chapstick, lotion, Germ-X, energy drinks and snacks, and earrings. We put earrings like this in there. My mom makes these earrings at Lavender Imprints. She had some baby earrings, some baby feet, some baby blocks, stuff like that. So gift baskets are always really nice, just to show your appreciation. And the number one thing is why I'm ending on it, so everybody knows that this is very, very important, is the car seat. If you do not bring the car seat, they're not going to let you leave with the baby. You must bring the car seat. They must see the car seat. You can't tell them it's in the car. Bring it up to the hospital room. They must see the car seat before the baby can go home. Okay? So that's everything that I can think of. I sat here and brainstormed that you would need. I'm sure there's other videos of more things that you could need, but I hope that helps. And remember, mama, you got this, and happy postpartum.